Hello, good afternoon everyone. Welcome to the sixth and final module of our webinar series on facilitating large-scale change. So I'm Ian Smith, Programme Lead for Improvement Methodology in NHS England's Sustainable Improvement Team. I again have the privilege of being MC for today's webinar. Other members of the Sustainable Improvement Team online today, keeping an eye on the chat box, are Georgina Hamill and Elaine Bayliss, and again Rachel Gray from the team will be supporting the interactive sessions of the webinar and looking after things technical. So please do get in touch with Rachel via the chat box if you are having a problem connecting to audio. We will do our very best to help. That said, we are having one or two problems with internet connection this afternoon. One or two things have been running slowly. We're hoping that it's going to hold up. We have a very good session this afternoon, so we are going to give it a go, and hopefully the internet gremlins will allow us to get through the session, which today we'll be joined by Liz Maddox-Brown and Rob Coburn, both Senior Improvement Managers in NHS England's Sustainable Improvement Team with our good selves. Liz has over 30 years experience in both public and commercial sectors, specialising in organisational change and improvement. Her work in the NHS has been focused largely on facilitating change at national, regional and at local levels, and in both provider and commissioning organisations. And her current portfolio focuses on network development and spread of continuous improvement. Rob also has experience in both public and private sectors, as well as in the third sector as a manager and leader of change. And before joining the NHS, Rob worked with the European Commission and the Scottish Office to develop information networks and has led one of the first social enterprises in Scotland, working there to develop a network of training hubs. So Liz and Rob will lead today's session, which will focus on creating and managing networks. So I think without further ado, if I hand over to your good self, Liz, to take us through this first part of the session.
Hello, hi, can you hear me? Just checking.
Yes, you're off mute, you're in charge, Liz.
Okay, perfect. Thanks very much.
Take it away. You're welcome.
Well, great to be leading the sort of climax of the LSC webinar series, and today we're going to be focusing on networks and network development and their role, quite a central role if we organise them and lead them correctly and well. In supporting large-scale change. So we're going to be covering for you the varying forms of organising for large-scale change, but thinking about network organising and hierarchies, something that you've covered quite a lot on the webinar series. We're then going to be sharing with you the Source for Networks platform, which is the SI support offer for network facilitators and leaders. And Rob's going to be walking you through the platform and sharing with you the really practical range of tools that exist on that platform to help you when it comes to leading and facilitating networks. And all of this should help you to put together a plan to either set up or strengthen the value and impact of your network. So let's go straight into it then. First of all, as it's the last webinar, we thought it would be really helpful, particularly for the content that we're covering today, just to do a quick recap and overview of some of the tools and models that you've covered. And I'm not going to do that in any great depth, but just emphasise really that sitting at the heart of these models and the leadership theories and approaches that you've covered sit great principles of engagement, co-production, partnership and involvement. And those principles really reinforce great features and principles of networks and network organising, because I think you would agree that often, although we work very much in a hierarchical world, it's the workarounds that often help us to get the job done. It's the connections that we have, it's the discretionary effort that we're able to tap into through colleagues that we know, so that we can really co-produce and co-design solutions, because these are the ones that really have sticking power. So it's often who you know, and often your ability to traverse the professional walls and hierarchical ceilings that really gets you some traction with your large-scale change endeavours. So, but first of all, what we're keen to know is, what are you curious about today? So if you just pop into the chat space the things that you're most interested to hear. and explore today?
Well, I'll help you fill this dead air, Liz, while we wait for some folks to share their thoughts with us. Good question early on, I think.
Okay, cross-boundary working, yeah, mobilising, great, sustaining, building momentum. Yeah, okay, that's lovely. So we will be covering, and you'll be pleased to know you've joined the right session. We will be covering the context for networks, we'll be covering organising principles, we'll be covering some network theory and the source for networks platform. So that's great, maintaining momentum. And we've got quite a content-rich session today, so we'll be quite pacey. But the good news is that on the Source for Networks platform, there are stacks of resources and tools that can really help you on from today, and you are able to contact, in fact, we'd be pleased if you contact either Rob, myself, or Georgie if you've got any specific issues or questions. So let's look at the context then, first of all, for networks. And I think, you know, if we have a look through the policy documents, the guidance and the reports that set out the ambitions and the direction for delivery models, the leadership values and the skills and approaches needed, I think it's really interesting to see that these words are quite prevalent: integration, collaboration, partnerships, joint working, cross-boundary hubs. System resilience is another thing that I know that you've covered in this series. And really, you know, all of these words and phrases have great implications for network forms of organising. So we've got the policy drivers and a lot there explicit about organising in network forms with and through. But why are networks so prevalent, or becoming more so? And they actually are quite a growing phenomenon. And I know, again, that throughout the webinar series you've talked about wicked problems. And you know, wicked problems actually are a legitimate categorization of problems. These are problems to which there are no known solutions. They need new approaches, new ways of working. They need principles of experimentation, co-design, collaboration, if we really want to create creative breakthrough solutions. So it's not a case of old wine in new bottles. It really does need to be new wine in new bottles. And this is about making the most of the effort between us. So, you know, how do we really work in multiple agencies? How do we learn and grow together? And that's all about wicked work. And networks are perfectly positioned. So you'll see there in the right-hand circle some of the real principles and the ethos of networks. They're about relationships, they're about sharing, they're about creativity and innovation. So perfectly positioned to address some of our big health and care challenges. I know as well that you've talked a lot about old and new power, what we know as a system, you know, we were set up in 1948, just had our 70th birthday, a very, very different epidemiology, different demography, different approaches to disease management, different technologies. So very much in 48, it was about all of those principles on the left-hand side. But today, in our world of 2018, if we look at any of the high-performing health systems around the world, you'll see that they're doing some fantastic work on all of those things in the right-hand box. Whether it's the NUCA system in Alaska that's doing great work with population health and the First Nation citizens in really positioning them as owners of healthcare, whether it's Intermountain Healthcare that are doing great work again in multiple agency collaborations to reduce demand, or the citizens and partnership work that's going on in Leeds to address drug and alcohol abuse. They're all adopting network principles and doing it really, really well and very successfully. But what's the dilemma then? So we know all the theory, you've talked about it in great depth, we know we've got to go from the from and the to, but the challenge is that when the going gets tough, I think we all know that the old world bites back. So we really do have to get our sights fixed on the future. and all of the things that you've explored in this series. So focusing on that desired state, and that desired state is all about relational leadership. It's about being able to work with whoever you need to work to, relevant to that task to get a really great outcome. And that means it's not based on expertise or positional power. It really is relational leadership and power. So coming up to a bit of interaction now. Molby and Anderson, who've done quite a lot of work that underpins the research and the theory and evidence for our source for network platforms, talk about the 3 ways of doing things, and this is a great entree into the network theory. So they talk about doing things well, very much the mechanistic approach. So if you do Y, you'll get X. It's predictable, and you need control. And it's often when you have a tame problem to work with. Then there's the world of doing better. So this is very much the improvement world. It's multiple iterations, incremental change. It involves lots of people. It's not particularly fast, but predominantly the world of improvement. And then the 3rd way is doing things better, which this is about sort of slapping things upside the head, as Bob Lloyd would say from IHI, and changing the way we do things completely. It's the relational, co-produced world. And this is very much the space that networks occupy. So I just invite you at the moment to go on to the animation. So you've got a little pen on the left-hand side. Click on the pen, click on the arrow, and put an arrow on the slide in the box that best represents where you think your large-scale change fits. Oh, great. Okay, so quite a lot there in the do better world, and a few there edging across to the doing things better. And you know what I noticed from the things that you were curious about when we first asked that question, it really was, how do you make that shift from a hierarchy into a world of sort of a more dynamic and more creative style of organising and leading? That's looking great. Great stuff. So it's good to see that for large-scale change, we're in the improvement and the transformational domains. Great. Okay then. So moving on. To summarise then, what we're seeing, and I guess what you're experiencing, is the challenge that Jones and Thomas talked about, which is very much in our world about how healthcare professionals and managers working for different organisations can be helped to work together effectively across boundaries in the interests of the intended beneficiaries. So that's whoever are the recipients of our services, and also the generators, the stakeholders. How do we really get to do this? And again, this is your big, large-scale change challenge, I would guess, as well, where you're having to work in a very complex and complicated and fast-changing, fast-moving world that can often feel quite volatile. So so some people are they're not able to create the arrows on this task. Okay, I'm not sure whether there's anything there more we need to do to enable you to use the animations, but Rachel will do what she can. So moving on then to how the work gets done around here. So just want to share with you some LaRue's theories on organisations, and give you an opportunity in a moment just to think about, so what does that mean for the organisation I'm in and also the type of work I'm trying to do. So LaRue sort of postulates that there are 5 types of organisation. The red, this is very much the chiefs and the foot soldiers, a very primitive way of relating to one another, very command. Often the metaphor that's used there is the wolf pack. Then we have amber, which is the hierarchical pyramid, conformist, thinking at the top, doing at the bottom. Often the army is sort of likened to the amber organisations. Then we have orange, where the goal is to achieve growth. Some organisations here like Coca-Cola and Walmart, where the workforce have reasonable opportunity to make their work reasonably interesting, and you can be reasonably creative. Then we've got the green organisations. Much of Michael West's work comes into play here, which is, you know, how do you really create strong engagement and strong focus on culture? And organisations like Southwest Airlines, Ben and Jerry's, great ice cream, are examples of organisations that operate in this space. And then we've got teal organisations, and this is about having no job titles. It's all very participatory. The power is well distributed. You don't have to fight for power. And a great example here is the Buurtzorg Health Organisation in the Netherlands. Absolutely central to their model of organising our patients and citizens, and they sit right in the centre, very much outward, inward focused. So, got a little poll here now for you. So what I'd ask you to do, Rachel, if you could pop the poll up, please, is to put a tick or a marker in the box that best represents the organisation that you work in, if you do work in an organisation. So even if you're working across systems, what is the predominant organising ethos and culture? Okay. Ah, very interesting. So, wow, that's looking, well, Amber, I guess that's not too unusual there. We've got many of you sort of suggesting that you work still in the sort of hierarchical pyramid, and a few encouraging results there, 29 and 13, as we shift through those organisations. So yeah, really interesting, and I just invite you to reflect on that in relation to your large-scale change, and, you know, thinking back to what we said previously on the 3 types of work, you know, do better things, and doing things better. So, you know, where does that fit, and how does that, what's the rub there between the organisational structure that you find yourself in and the type of work that you're needing to do for your large-scale change? So let's move on then to how do we organise our work? So we've talked about those Laloux's model of organising and the different organisational forms, but what does this mean then for us and our world and networks and network organising? So the theory goes that in our world, in our health and care world, that there are predominantly 3 forms of organising. So we have the hierarchy, which is organised to address tame problems, as we talked about earlier. X, if you start at X, you'll get to Y. Highly controlled. There's a clear objective. There's an uncontested route to achieving it. They're effective and efficient with resources when they're working on a very linear and deterministic problem. So in the hierarchy, the goal is clear. The work of world is predictable. And then I'm going to look at the adaptive system. So this is very much the domain of doing things better. So this is about systems-based approaches. This is where there's a lot of emphasis on scientific data, iterations of change, really strong involvement and collaboration. Metrics and feedback loops really feature quite highly here in sense making. And adaptive systems are great for highly contestable problems where it's not really clear what works, but there are multiple interdependent agencies. So it is a form of organising, very much organised around addressing process and process improvement. And then we have networks. And networks occupying that domain, as we talked about, as they're defined as cooperative structures where an interconnected group coalesce around a shared purpose. Members act as peers, and it's based on reciprocity and trust. Very innovative, and the knowledge function is quite central and core to an effective to an effective working process in a network. And people usually work within a network or join networks when they have something to offer them, and whilst ever they are producing value and outputs that they value and their stakeholders value. So I'm just going to go and ask you now then to think about our world of the NHS, our world of health and care, and to drop into the chat space. What do you think, what sort of work is best done through a hierarchy, what through a network, and what through an adaptive system? So some examples here of you know, from your perspective and your experience, where things are being led through hierarchies, networks, and adaptive systems. I'm seeing that we are having some issues, technical issues for some folks. Yep. So we've got. I'll just come to wicked mean in what does wicked mean in an adaptive system? Okay. So thanks, John. So what does wicked mean in an adaptive system? Well, I guess it goes back to that GRINT definition where there's no real tangible or known solution. It does take some experimentation, but because in an adaptive system, more principles of improvement, PDSA cycles, and many of the principles of the change model apply, there isn't as much opportunity for experimentation. And actually, the lines between networks and adaptive systems are quite blurred. So it's not a black and white characterization, so I hope that helps. So I'm just going to pause there for a minute and ask Rob and Georgie just to give some feedback on what you're seeing in the chat space, please.
Okay, yes. Can you hear me all right? I'm conscious of the internet issues. Yeah, I mean, notice the one, Lucy, for example, mentions, you know, work, hierarchical work. If you want to manage a cardiac arrest, then a hierarchy actually works quite well because everybody's very clear and told what to do. Whereas the flexibility is needed to address more diverse needs. And similarly, a hierarchy very useful for governance issues and so forth. Notice the comment from Monica about hierarchical power to leverage change on a wider scale. That's an interesting point. It would be interesting to hear from other people as well as their views on that. Whereas networks are required for that system-wide change, that adaptive process to work across very different structures and organisations.
Okay, thanks, Rob. Georgie, is there anything you've spotted there? Any questions that need picking up? Can't hear Georgie. And noticing there people are talking about governance, and governance certainly is something that needs to be paid attention to in networks. So we'll be talking a little bit more about that, and Rob will be exploring that with you when we get into at a high level, when we get into the section on the social networks platform. But the reality is, and this is often the tension and the balancing act, that in today's world, we really do need to straddle the two. And this was a quote from one of the chief execs that we've been working with to help them set up a network. And, you know, there's no getting away from the fact that hierarchy is necessary, that a network isn't the silver bullet all of the time, but there are things that need to be attended to in our formal system. So it's often working with the both and. So moving on then, let's get into the network theory. Mendezabal and Hearn talk about 6 functions of a network. So I'm just going to give you a brief overview of this, and I want you to think a little bit about your large-scale change, and if you have a network or you're thinking of setting up a network, which functions are the strengths of your network and which ones are the ones that you would need to pay attention to. So first off, let's start with filtering. This is about how networks organize and manage relevant information for their members. So that's a key function. Convening, so bringing people together from different groups with distinct strategies to support them. Amplifying, this is often a really valuable functionality of a network. So helping to make things known, so things that are little understood or little known, or where there are small voices that really need to be amplified to spread a message or to secure a resource or give them weight. Networks have a role in creating powerful voice. Facilitating, this is about helping members to carry out their activities more efficiently and effectively. And you remember that I said that people will join networks and stay committed to them whilst ever they are working for them and their organisation, whilst ever they're helpful. Investing and providing, which is about providing members with the resources they need to carry out their main activities. And community building, you've talked a lot about this, and there were some questions earlier from people about how do we mobilise? Well, I know you've covered that, but principles apply, same principles apply when it comes to organising for network work. So again, I'm going to ask you just to pop an arrow on if you have a network, where do you see its strengths? And if you were setting up a network and you don't have one, where do you think it should focus? So go for the main one, using the arrows on the left-hand side of the screen. Community building, that's interesting. Amplifying, yeah, a lot there on community building. Oh, we've got a nice circle coming up there. Amplifying, investing. That's really interesting because one of the central functions of a network should be its ability as well to capture, distill, and filter information. So I'm interested to see there that there's quite an emphasis on community building, convening, facilitating, but not such an emphasis on filtering. And Richard has got a question mark there. He's just, I think maybe, Richard, are you feeling a bit confused? So just building on that then, so those are the 6 functions of network. And again, think about this for your current network, and think about where are the strengths, where do we need to strengthen? And then let's think about network typologies. So in the work that we do, and it's based on Molby and Addison Wallace and their research and evidence on our platform, we define networks mainly in 3 categories. So we talk about delivery and developmental networks. So these are networks that bring people together across boundaries to focus expertise and minds. And this is often about where there are activities that have a wider benefit for joining up services. So this is often about service delivery. So a network of people committed and passionate with equality of expertise and hierarchy to deliver greater benefits to service, so add greater value, streamline, improve services. The one then that you're probably most familiar with are learning and support networks. So these are true communities of practice where you get great distributed leadership. They're focused on sharing knowledge, which is that filtering function that we talked about and saw on the last slide. They're passionate and good at sharing online and face-to-face, and they really exceed when members are committed to the intelligence that they generate, but they often fail when their motivation and commitment and transparency and sharing kind of dwindles and people stop getting the value from those networks. And then we've got the advocacy and the agency networks, and you'll remember we talked about amplification. So these are networks that tend to come together for lobbying, for influencing, for advocacy for a common cause, and really giving people and causes a voice. And some examples of networks then that I'd encourage you to have a look at to see how well or not they match your need for a particular network model. The Mayo Clinic, and they bring together over 4,000, almost 5,000 clinicians and healthcare scientists out in Arizona, Florida, and Minnesota, and they're doing some really great things to support citizens to get amazing care, and that is through a really great collaborative, huge span of delivery networks. the co-creation network, which is a great example of a community of practice made up by dedicated health and social care professionals, academics and service users. And they really are in a space where they feel safe to connect and share knowledge and to be open and supportive, true principles of a community practice. We've got the future-focused finance network. We've got one of their case studies on our website. This is a great example of where clinicians and finance managers have been brought together to learn from each other, and where some clinicians have been developed to be clinical educators. So they are really working well across the piece within trusts nationally and regionally to support and champion great financial management within clinical services. And then we've got an example there of the Parkinson's UK, which is a great advocacy network, and they do support their members to better self-care, but their biggest aim is to raise and rally commitment and raise visibility, and to create better understanding of the condition in order to secure resource. And often these are self-governing networks where people pay into them. They tend to fail when the concern for democracy gets in the way of delivery. The two that we're not going to talk so much about at all, really, because they don't kind of fit into our sort of definitions of networks, are managed projects, managed networks, and social networks. So this is managed networks are things that the NHS calls networks, but actually they're managed programs or projects. Usually somebody's in charge, and the leadership of these networks can consult the community, but then goes away and does the work for them. And we are seeing less of these and more what we would call real networks emerging. And then we've got social networks, which again don't really fit with our description or our definition of organising for health and care, but they are really communities of interest, and they're great for gleaning information, testing the temperature of things, but no real common purpose. But they can be used really well to support and wrap around the other forms of network. Just again, if you take the arrows and look at what sort of network are you involved in to support your large-scale change, or do you think would be most appropriate to set up to support your large-scale change? All right, great. So a lot there going in the developmental delivery and the network. So that's great. So again, and it is important, like all things, to understand what type of network you're working with in order to set it up and organise it to best effect. Lovely. Great. So we're all on the right track, which is good. So I'm just going to ask you to drop into the chat box now. In your view, what are the conditions that are needed to make networks survive and thrive? Yeah, great. Shared goals, interest, yep. Participation, enthusiasm, commitment, great. Yeah, mutual respect, brilliant. Relationship and trust, energy, yes. Room for confidentiality, yeah, brilliant. So these really are all great principles that should underpin great network organising. So I'm just going to move on to look at and share with you what is it then that makes networks really distinctive and different to hierarchies. So you can see there it's when they're innovative and creative, they've got well-distributed power, reciprocity and exchange, which is a word I could never say before I started doing this work. They're adaptable, able to survive and thrive. Really key to network principles is this principle of power and distribution across the members. And if you have a look at the three principles of large-scale change, you'll see there how network principles really underpin pervasiveness, depth and size. by the way that we set up to engage, the way that we set up to be innovative and creative, and certainly with the pervasiveness dimension, how we really work to engender distributed leadership. But networks often fail for a number of reasons. Go back. They fail when there's no shared purpose and identity. Networks work when, getting ahead of myself. So networks really work when you've got purpose and identity. They're creative, innovative, they meet members' needs, they have strong relationships and ties and generate helpful outputs. And you'll see there the change model and the real synergy between the components of the change model and the principles of what makes a great network great. So not least of all, shared purpose, leadership by all, motivation, mobilization, and measurement. So, you know, network members need to feel that their networks are really producing great value, and that then becomes the case for sustaining and maintaining them. But there are some mistakes that tend to occur, and I'm going to just ring those three there to pay attention to, because very often we don't spend time working out common purpose and understanding. We put the wrong structure in for the wrong kind of, or for the right kind of problem. So you remember I talked about the three ways of working: do better things, do things better. We talked about the three different types of networks and organising. So it really is an art to think about what kind of work are we trying to achieve as a network, what kind of organisation are we sitting within, what kind of structures do we need to enable us to do our work really well, and how do we manage and engage our members. So on that note, I'm going to hand over to Rob, who's going to talk you through the Source for Networks platform and how the tools and resources on the platform can really help you to develop a plan to set up a successful network.
Okay, thanks, Liz. If I can just get a bit of feedback, check on sound again, because I'm aware of the internet connection problems.
Coming through loud and clear, Rob. You're perfect.
Excellent. Thank you very much. I think Liz said right at the beginning of this presentation that I'd do the walk through the platform. Well, in reality, it's actually going to be a bit of a cardiac section because there's a lot to cover. The platform is very, very rich in resources and information and tools and case studies and everything else. No way we can cover it all today, but I just want to give you a taste of it so that you can then go away and look at it for yourself. And taking account of what Liz has said as to when a network is the appropriate approach. So when it is the appropriate approach, go on to Source for Networks and you'll get a lot of support and a lot of information and tools there. So basically Source for Networks, it's what it says on the tin. It's a resource that provides support to network leaders to strengthen and improve the impact of their leadership and the effectiveness of the networks. And it builds that network leadership know-how and the membership know-how because there's a lot of information, evidence-based resources and practical learning tools that are there. And it also enables leaders and members of networks to connect both within themselves and network to network. But the really key function, really, if you know, the sort of jewel in the crown of the Source for Networks is the set of diagnostics. And I will show a little bit about those as we go through this presentation. So first of all, I'd just like to emphasize this point about the fact that the platform is based on evidence and research. And here are some of the documents, of a small smattering of the evidence and background to the principles and foundations of network management and leadership. But particularly, I'd like to focus on the effective networks for improvement from the Health Foundation. And this document actually is the one that introduces the concept of the 5 C's. Now, this tool provides a number of five interdependent factors to pay attention to really create a successful network. And it was developed by McKinsey & Company, who, as we know, are sort of fairly major consultants in the world of business and institutional management. and they have worked both nationally and internationally in the field of healthcare. So it has a definite pedigree behind it in terms of that. And it has been used extensively. The concept of these particular aspects have been used extensively through the UK with a range of networks to create a health check and is part of the basis behind the maturity matrix and effectiveness over time for networks. So all of this background and research has gone into what we have decided to do and help put together with Source for Networks. This is a screenshot of the platform itself. It is something that we have worked together with London South Bank University to create. And it, as I say, the target is basically to enable effective network development, but there is also space there to actually create networks and manage networks as well. Could we just have a show of hands as to who is actually aware of the Source for Network platform already? If you'd like to pop hands up. Oh, quite a lot of hands coming up. Oh, I'm seeing lots and lots of hands, which is fantastic. That's great. Obviously, you know, if you're aware, that will be at different levels. Some people might be actually already on and using the platform, and others maybe just have that general awareness of it. But it's about, that platform is the, as I say, with very rich resources to give people the confidence and capability to lead networks on that kind of edge of chaos, that sort of, we quite often show a picture about a person jumping a chasm, which is that leap between the hierarchy and network process. And the magical trick is to actually somehow stay suspended in the middle. So it really is cutting edge stuff in many ways. So oops, I seem to have my interactive tool operating at the moment, so apologies about that. The trick in doing that is quite a challenging one. And at the moment, we have quite a lot of people developing into that leadership role and that networking role through the platform. So this snapshot was done till the end of May. At that point, we had under 700 people on the platform. It's now just tipped into 800. Quite a lot of networks setting up, some very, very big networks starting to develop in particular sectors. We ran webinar sessions back in 2017 to introduce the platform. We're doing more webinars this year and various events this year. So, you know, good time to get on with it. We also have a lot of resources and case studies on the platform. I'll leave those for you to peruse. If you go onto the resources in the case studies, in the platform, then you'll find the case studies, you'll find lots of information. As I say, it's just trying to give you a flavour of what's there. So what I want to look at a bit closer is the diagnostics. And as I've said, these are evidence-based. They do provide a mechanism to give feedback to the whole network. They're a systematic approach, so they take a snapshot in time that can be repeated, so you can start to look at progress, see where you need to focus effort. And they really are about providing that framework for the robust and challenging conversations that sometimes need to take place, so people get a better shared understanding of how the network works and how it can improve. There are three diagnostics. Again, if I could just have a quick show of hands if people are familiar with the diagnostics. Hands coming up. Yeah, brilliant, excellent. Well, not quite so fast and so many as came up as to the familiarity with the platform, so that's quite interesting. Apologies about that. So, as you can see, there are three tools. There's a core questionnaire, there's the maturity matrix, and there is the health check that can be done with the membership. And the core questionnaire, which is where you start, looks at the key features. What's the purpose of the network? Again, that link into the change model. What is the overarching goal? What will it look like when you're successful? What resources and how are you structured? What's the size and spread and level of participation? Who's involved in the immediate leadership? What funding, what support do you have? How are you going to use it? What are your external audience influences? And what products and agreements and outputs do you have? And it also looks at how you start to spend time in the network. There's a sliding scale that looks at what you are currently doing in terms of knowledge management, amplification and advocacy process, community building, the convening, the mobilization, and then it also allows you to identify where you would like to move to so that you actually start to make the network as effective as possible. We'll take a slightly closer look at the maturity matrix. This was developed through the Health Foundation by Chris Collison, who's a knowledge management expert, along with a team of about 7 or 8 other people who are all key experts and leaders in the field of networks. And it's designed to stimulate and inform the structure both in face-to-face meetings and online. And it looks at 8 dimensions. So across the top, we have the 8 dimensions of effective networks. And these are based on that research that I've talked about. So the purpose and direction, again, that direct link with change model, governance and structure, leadership and facilitation, knowledge use and knowledge capture and reuse, the integrity and vitality of the network, how learning and improvement is taken forward, very importantly, what is the impact and value of the network, and how will the sustainability or potential renewal or closure of the network take place. And I'd just like to focus a little bit on that impact and value, because there is that concept that networks do not have the right to exist. If we take them outside that kind of project area that Liz talked about and look at them as that developmental learning advocacy process, they don't really have that right to exist. So they have to show what their value and impact is. And when you work through this maturity matrix, then you actually can then produce a graph that can identify where your key gaps and areas of focus are. So very, very useful tool. I would encourage those who are leading networks to really take this forward and have a look at it closely. Go onto the platform. A little bit more about securing purpose. So purpose is around that, why the operation, why the enterprise exists. It unifies people, and strategies don't mean anything unless people buy into them, unless they have that higher purpose behind them. And it's what anchors your network and helps make decision making a lot easier. And as Collins and Horace state, a good purpose statement should be broad, fundamental, inspirational, and enduring. Motivation is found when purpose is discovered. I think that's quite a sage little statement there. So within the core questionnaire, there is that need to develop the purpose. It looks at what your resources are, etc., as we mentioned, but the purpose is very, very fundamental. And I've already mentioned that link with the change model. And of course, there are models of large-scale change. So it provides you with that process to engage and connect with other people and extend your network. Here's an example of a purpose statement and a statement about resources and influences. They don't need to be overburdening. They can be very simple, but they are part of that developing the narrative around what the network is about, how it's going to operate, what it's going to do. And the example that Myrto uses from the network that she led, integrating health and social care on the Isle of Wight, networks bring together very different people with different backgrounds and even professions to work towards the common goal. So you really need to develop that network framework to take that forward. We have a minute or two left, so what I'm going to ask you to do here is, this is one of the dimensions of the maturity matrix, about that purpose and direction. And it takes you through the 5 different levels, and 5's considered to be a good number to, too many more, and you just get too granular, too few, and you wouldn't really get any clear distinction. So 5 is seen as a good number of levels. From level 1, no sense of goals or plans, so there is no real purpose. Nobody knows quite what they're doing about it. Up to level 5, which is the aspirational perspective of the network. Challenging to attain, but something that eventually everybody should be trying to work towards. So that is a really high-functioning network. So what I'd like you to do is just think about any network that you're involved in at the moment, and then just pop an arrow against the level that you think that network is at the moment. Okay, starting to pile in here. Lots of 2s, lots of 3s, somebody at 4, somebody at 5. Brilliant. Excellent, excellent. Good, good. If we were doing this live in a workshop, or using a flip chart and doing dot voting or whatever, or using this on the screen, what we'd then do is ask you to have a discussion around that. If you were all in the same network, why are some of you at 5 and some of you at 2? So that's where the discussion starts to open up. Also then we would say, well, where do you want to be in 6 months, 9 months, a year? And start looking at that. And doing that for all the dimensions. As I said, that is a very quick cardiac session through the network platform, through Source for Networks. Really would encourage you to go on and have a look at all that information, the resources, the learning, and start to think about how the diagnostics could help you if you are developing a network around your large-scale change, how you can really make that network operate in a way that adds value and provides an impact. And at that point, I am going to hand back to Elaine.
Well, thank you very much.
Back to Ian.
Yeah, thank you very much. Thank you very much, Rob and Liz. It's my Sunday name. What can you do? Thank you very much. I think that we might have time. Oops, a little bit too far there. Time to take 1 or 2 questions. Elaine, is there any good questions in the chat box that we might be able to ask Liz or Rob to very quickly address before we bring the session to a close? We've got a few things to tell you about before we close out. Hopefully you'll be interested in some of those things.
Yeah. Okay, so there's been all sorts of chat going on in the chat box and people sharing thoughts and ideas and really appreciating what's been shared. I think Kathy made a comment about it really is about focusing on the people and not just the process, which I think has come through really strongly. And there's been lots of chat about sustainability. And people saying actually sustainability is often afterthought. So be interested in Liz's and Rob's thoughts on actually how networks can really help with sustainability, because that has exercised people in chat.
Okay, I'll pop in there just initially. I'm sure Liz will have something to say on that. But one of the things that I think that sometimes you need to take into account when you're looking at a network, and it goes back to that context of, the network doesn't have a right to exist. So at the point where it's stopping doing something useful and stopping adding value, then you really need to think about, do you want the network to be sustainable, or is it time to quietly put it to bed? And we've had a number of situations where people have used the diagnostic tools to challenge the operation of their network and whether or not they should continue it. So I think that's something that I'd say up front is, things don't have to exist forever. They can move on.
Okay, thank you. Did you have a comment to make, Liz? Nope. Okay, I think we've got time for 1 more question, and then we will move on to wrap up the session for you folks.
Okay, so I think going back to something that was much earlier in the chat box actually that Angela Douglas raised, and it was when we were looking at types of organisations, and she was sort of saying her organisation is green, but they're trying to co-design with an amber organisation. That's really challenging. So just wondering of the panel's thoughts in terms of if you're working across a network in a networked way, but with people who are in different spaces or in different stages of their maturity, how can networks help with that? What top tips have they got?
Hi there, Elaine. So I think it is about what we discover is understanding, is it a network you're trying to establish, or is it a hierarchy, and is it a developmental, so thinking about what's the work to be done, what's the form of network that we need to put in place, and just remembering that you know, the NHS calls a lot of things networks, and actually they are more managed programs or projects. But what we do often find is that the diagnostic tools, particularly the matrix, even if you print it out on an A0 a piece of paper and have a good conversation with the people that you're trying to work with, it really does bring about some aha moments, and you can start to explore, you know, are we clear what our shared purpose is? Have we got the right leadership to help to take us towards that? What kind of governance with a big or a small G do we need in place? So really those tools are a great OD intervention to have an honest and frank conversation about how do we need to work together, and bearing in mind that we have got hierarchies we need to pay attention to. How do we create a network that can straddle both needs of the formal world, but also focus on the creativity that we need to in order to make the transformational change we need to make.
Okay, that is excellent. Many thanks to yourself, Liz, and to Rob for another excellent session. Excellent session to close out the webinar series on large-scale change. Hopefully, very practical things to do to help with our large-scale and transformational challenges working in a networked way. Which brings us with a hopefully smooth segue into a couple of things coming up in the next week. Those who have a thirst for more on networks, Liz and Rob are running a webinar with Chris Collinson on Monday, this coming Monday on the 16th from 4:30 to 5:30. And again, those who are looking to get other colleagues involved in quality improvement, perhaps in running some of the lots at a smaller scale within a larger scale change, Improvement Fundamentals course 101 kicks off on Monday of next week. As far as the Virtual Academy of Large Scale Change goes, all of the resources that we have used in this series are available on the collaboration space. That includes the PDF of the slide decks from today and all of the other sessions, as well as the recordings if you missed one or just want to catch up or rerun one of the sessions. All of the stuff is on there. And also information about how to obtain CPD points for any of the sessions that you have attended. You can do that via for this session, via the questionnaire that will pop up in your browser when the session ends. For any that you've missed, you can take the questionnaires needed to get those CPD points from the collaboration space. So please do join if you have not already. And to bring things to an end, what's coming up next? Now open, we have some masterclasses on system leadership and large-scale change as part of our Virtual Academy series running in the autumn in London and Leeds in September of this year. Expressions of interest to come along with a team working on a transformational change or large-scale change challenge are now open. Again, predictably, the place to find information on that is the collaboration space. Another good reason to join. The link is in there, and I think that my colleagues will just pop that into the chat box. I think we'll mail it out afterwards so that you will be able to express interest if you want to come along. And it would be fab to see many of you at one of those events in London or Leeds later this year. Following on from that, we have a kind of a third masterclass, which is a follow-on from the first two, for delegates who attend one of those on knowledge networks and impact about a month or so later in October. And I think, unless Elaine tells me different, I think that is everything that we needed to cover for this session. I hope that you have enjoyed the series as much as we have. As I say, it's been great to see so many names come back week after week. It will be fabulous to see some of you in September on the masterclasses. So I think that is all there is to say. Many thanks for joining us again. Please do get on the collaboration space. Please do let us know how you're getting on with your large scale change. Please do come along to one of the events and have a fabulous afternoon, people. Many thanks for joining in the Academy of Large Scale Change.